Hi, I'm Dr. Carpentier. I'd like to talk a little bit today about how acute pain becomes chronic. Everybody understands that pain has value. It improves our survival. Say you're out doing something today and you fall and break your leg. The pain will warn you that there's been damage and encourage you to rest long enough to heal. Pain is not just a simple pull a string, ring a bell in the brain, ow, I hurt. It's much more complicated than that. Think back to a time when you burned your finger. At first it hurt right on the finger where you burned yourself, but over time, minutes, the entire finger began to hurt and throb. Why is that? That's peripheral sensitization. The body is doing things to make the finger hurt more, to encourage you to rest it. If it's a more serious injury, you can even see the volume turned up in the brain. That's called central sensitization. It also has survival value. Central sensitization is like turning on a very loud alarm bell, telling you you've done something wrong. You need to give yourself some rest and allow it to heal. All of this is normal. It happens to everybody who experiences pain. When it becomes abnormal is when it doesn't go away. So unlike acute pain, chronic pain doesn't really seem to convey any survival value. It doesn't improve our lives, it doesn't help us live longer, it doesn't keep our body functioning any better. So basically what's happened is your brain and your spinal cord and your entire body have learned to experience pain. Pretty much everything you do has become a painful experience, and it's because of learning. Chronic pain is essentially learned pain, and just as it's been learned, it can be unlearned. Chronic pain, by definition, is pain that continues after you would have expected things to heal. So, for example, you may get a paper cut on your finger. That pain ought to go away in a few days, whereas if you break a bone, it might last months. Regardless of what the original injury is, if you're still having pain beyond the time that it's expected to have healed, we now classify that as chronic pain. It's important to understand the difference between acute and chronic pain, because the longer chronic pain goes on, the harder it is to treat. It's much easier for me to address a problem that you've had for a few days or a few weeks or even a few months than it is to address a problem that you've had for a few years. If any of you are involved in skill sports such as golfing or skiing or shooting, you understand that it's important to learn the right technique the first time, right? Because it's much harder to unlearn it and relearn it than it is to do it properly the first time. The same is true with pain. It's much harder to unlearn severe, unrelenting pain than it is to avoid developing it in the first place. This is a big reason why it's important to seek treatment sooner rather than later. Now, I'm not pitching medical care. What I'm trying to do is explain to you that chronic pain is serious, chronic pain is hard to deal with, and the longer chronic pain goes on, the harder it is to treat. So I want you to understand that chronic pain is kind of a learned behavior. Your body and your brain and your spinal cord have learned how to very effectively experience pain. In fact, they're so good at it now, they don't even need the original injury to continue telling you you hurt. The more you dwell on it, the more you think about it, the more you focus on your pain, the worse it actually becomes. You're improving your memory for pain. So what should you do? You try and unlearn pain. There are some basic things that you can do right away. You can distract yourself. You can stop thinking about the pain. This may sound contrary to some of the other information that's been given to you by other people, but it's really important not to dwell on your situation. Read a book, go see a movie. Just stopping thinking about it for a little bit of time can make a difference in your overall quality of life. There are other things you can do to train your brain to more effectively unlearn these behaviors, such as meditation or yoga, and there are even some very specific psychological therapies aimed at teaching your brain to unlearn the information. These include mindfulness or cognitive therapy or behavioral therapy or some combination of these. All of this can be very effective at helping to reduce the experience of chronic pain and possibly even eliminate it. Again, I'm Dr. Carpentier. I hope this information on how acute pain can become chronic pain has been helpful.